Hello and welcome to another episode of the CIRS Group podcast. I'm JC,
And I'm Barbara.
and today we're talking about melanocyte stimulating hormone, or MSH, which don't leave. I promise. I promise this is important and exciting. This hormone is basically responsible for the majority of the symptoms that you experience with CIRS, and we're going to unpack some of that today. But before we jump in, just a reminder, we are not medical professionals. We are patients. We run a community of people who are healing from CIRS. We read the textbook. I took the proficiency partner exam. Barbara's reading through the materials right now. So we're knowledgeable, but this is not medical advice. So definitely check in with your practitioner if you are planning on changing anything with your treatment protocol.
Boom.
Okay, so melanocyte stimulating hormone, MSH, that's what we're going to call it for the rest of this episode. So this hormone is normal for the human body. In CIRS patients, it's low. So what happens when you have CIRS is you have that genetic predisposition to being really bad at eliminating a biotoxin. And how that functionally works is your body understands it has a biotoxin inside of it and launches the innate immune response. What would normally happen if you didn't have CIRS genes is that innate immune response would hand off to your adaptive immune system. It would create antibodies and help you eliminate the biotoxin. With CIRS patients, that doesn't happen. We're just stuck in that innate immune response. And so that inflammation causes inflammatory cytokines, which is a normal part of your inflammatory response, but it's so dysregulated that those cytokines bind to the leptin receptors in your pituitary gland, and then it prevents us from creating as much MSH as we would need to. So you end up with very low levels of MSH. If you, like myself and like Barbara, when we first started treatment, got your MSH levels back and it said undetectable, that is very common for CIRS patients. Very, very common.
Yeah. And it sounds really depressing when you see it. You're like, wow, it doesn't exist and I need this hormone. Awesome. And the reason that it is kind of sad is because JC mentioned this at the top, but I have to reiterate, it affects like so many systems in the body. So all of the pretty much all of the systems. If you are having random symptoms, which again is very CIRSy, it's probably because your MSH is really low. It just affects absolutely everything, and it sucks when it's non-existent.
Yeah, so Shoemaker, the man who created the Shoemaker protocol, which is the only clinically proven path to healing from CIRS, it's the protocol we're both doing. He created a biotoxin pathway chart that you can look at. We'll go ahead and link one down below, but it actually shows how this process of the inflammatory response and the cytokines and binding to the leptin receptors and the low MSH affects all of these different systems. And to Barbara's point, like it sounds like melanocyte stimulating hormone. It sounds like it has to do with the melanin in your skin. It does, but that's the least interesting thing that it does.
Yeah, some of them, the more, I wouldn't say exciting, but like necessary things that it affects is it reduces your melatonin, which can cause sleep disturbances. So many people with CIRS do not sleep well. They don't stay asleep. They have trouble falling asleep, all of the stuff. There's suppressed endorphins, which can cause chronic pain. This is the one that I struggle with, leaky gut. It affects the tight junction regulation of your GI system. And so if you are someone who is susceptible to inflammation from the foods that you eat, probably because of a leaky gut situation, which is probably caused by low MSH.
Some other things that it does is it causes immune system dysregulations when you don't have MSH controlling the immune system. Your immune system becomes dysregulated. So you can have both prolonged illnesses, but also a lot of co-infections. So this is something we see really commonly in CIRS, people with co-infections. So whether it's a GI co-infection like H. pylori, SIBO, SIFO, you're just more likely to get things and not be able to fight them off because your immune system isn't working correctly. But probably the most common one is MARCoNs. So MARCoNs is the antibiotic resistant staph that most CIRS patients have in their nose, and it is a step in the protocol to eliminate it. And it kind of has this cyclical effect because once you are colonized with MARCoNs, it then also suppresses your MSH. So because your MSH is low, you got MARCoNs. Now that you have MARCoNs, your MSH can't raise. And so it's really important that you do the protocol in order, remove exposure, take the binders, clear the MARCoNs.
And a note on the MARCoNs too, even if you are clearing MARCoNs by doing the nasal spray medication, whichever one your doctor has told you to use, because there are quite a few options, you'll want to actually keep using it in some way. Again, go with what your doctor says, but you want to keep using it until your MSH starts to raise, because once your MSH raises, then your body can fight off the MARCoNs more on its own. But until that moment happens, and we'll talk about it more later, but it can take quite some time for your MSH to come back up to normal levels. In that process, you'll want to kind of keep the MARCoNs at bay by continuing that nasal spray medication while your MSH is still low.
Another effect that it can have is cortisol and ACTH dysregulation. So those hormones are associated with stress and stress management. So that fight or flight situation that a lot of CIRS patients are stuck in is due to this being dysregulated. And it, quote unquote, liberates the immune system. So your cortisol, what happens is your cortisol gets so high at first because your body is being exposed to this biotoxin that it can't eliminate, and it's physically stressful to you. It raises so high that your brain is on fire. It's just filled with cortisol, and that's a really dangerous situation for your body to be in. And so what it does is it just drops your cortisol levels so that you're not harming yourself with that cortisol. So that's the reason why we see a lot of CIRS patients have normal or low cortisol levels, is because your body is shutting that off. What happens when you shut that off is it's another mechanism that was controlling your immune system is no longer in place to do so.
Yeah, definitely something I've dealt with. And another thing is your sex hormones. A lot of people with low MSH are also going to see dysregulated or low hormones like DHEA, testosterone. Everything's going to be a little bit out of whack because, again, those systems are not being supported the way that they should be. And this can manifest in symptoms like reduced libido, hair loss, period problems like late or spotting or PMSing or all kinds of fun stuff. That could be a rough situation. So if you're experiencing those symptoms, getting your MSH up is going to better support those processes as well.
And another really common CIRS problem is dysregulated ADH osmolality. So ADH, or antidiuretic hormone, helps regulate water retention in the body. And when this becomes dysregulated, it can manifest as frequent urination, frequent, like insane thirst. It can also result in things like bedwetting. So it causes a lot of electrolyte imbalance. And I don't know. I feel like a lot of CIRS people have this. And it was funny because when we went to CIRS X, Scott McMahon did a talk about ADH osmolality dysregulation. And he made the joke that some of his patients said, well, I pee a lot because I drink a lot. And it's like, okay, but why are you drinking a lot? It's because you have ADH osmolality dysregulation.
Yeah, and another way this can manifest, again, given the electrolyte imbalance, is like fainting and passing out and pot symptoms, all of that stuff. Your brain and your body are not communicating properly to maintain that homeostasis that is required to keep all of that stuff good. And so anything out of the norm, some stress, so anything can like throw you totally off balance and can cause it to manifest in really scary ways. One of our members, and a dear friend of mine, faints somewhat regularly. And like that's just a really crappy normal part of her life, unfortunately, that hopefully will be resolved as she makes her way through the Shoemaker protocol.
Yeah, a good way to tell if you might have ADH osmolality dysregulation is one, if you require electrolytes in order to exist. But also two, if you're under 45 and you're waking up in the middle of the night to pee, that's not normal.
Yeah.
That's not normal. And it's not just you aging. That is likely ADH osmolality dysregulation.
Yeah, and to take it a step further, during the day, normal, healthy people are probably only peeing 3 to 4 times a day. And it's like wild because some people will hear this and go, but I pee 10 times a day. And it's like, yeah, that's what we're talking about here. And I'm with you on that. So
So all of these things we just talked about are all the downstream effect of low MSH. So it's important for CIRS patients to try to recover their MSH. It's going to contribute a lot to the reduction of symptoms that we experience as an effect of CIRS. And so the number one way that you can raise MSH is by following the Shoemaker protocol, really doing those steps in order. Step 1, removing exposure. Step 2, taking the biotoxin binders. Step 3, doing the MARCoNs so it's not having that cyclical effect. And then following the rest of the steps as indicated by your symptoms and blood work. When we were at CIRS-X, we were very lucky to hear Dr. Peg DiTullio and Dr. Christian Navarro-Torres talk about some of the research they had done with raising MSH. And they found some interesting stuff. And I'll just preface this by saying all of these results were pre-VIP. So VIP is the last step of the Shoemaker protocol. And the study that they did was pre-VIP. So that's important because it indicates that MSH can be raised prior to that last step of the protocol. So some of the things they found really helpful to raising MSH before that last step was histamine support. And I find this one really interesting because they found whether or not people had histamine symptoms, their MSH would raise if they had histamine support. So what that means is like some people might not present with really strong histamine symptoms. However, they're more likely to recover MSH faster if they are getting some sort of histamine or MCAS support during the Shoemaker protocol.
Yeah, that was kind of exciting for them to be able to demonstrate, especially before VIP spray. Yeah, it'll be cool to see more data come from them.
The other things are more related to co-infections you might have. So, for example, Lyme patients who got Lyme treatment, people who had either had COVID or the vaccine who did spike protein protocols, and then people who were able to eradicate their MARCoNs all showed their MSH was able to raise before that last VIP step.
And yeah, and I will say I'm one of those people. My MSH has raised. I think last I was tested, it's up to 19 and it used to be undetected. But in that process, I have been pretty diligent with the MARCoN spray. And I think that in addition to following the Shoemaker protocol, getting out of exposure, taking the binders, all the things, I have seen my MSH rise slowly but surely over time. And so I hope that's and I'm still doing the sprays because my MSH is still not up to that at least 25, but ideally over 35 level. But I'm getting close. So there's hope for you if you're listening to that.
And the reason why I'm stressing so much that their studies were done pre-VIP is because if your MSH doesn't rise from eliminating exposure, doing the biotoxin binders, and eliminating MARCoNs, it's possible that the VIP step will elevate it. And that's from Dr. Shoemaker himself.
Yeah. So
So
if
it's pretty exciting.
Yeah, definitely. And that's something again, so if you're feeling sad every time you get your blood work done because your MSH is still non-existent, there is hope that the VIP, once you get to the VIP spray, that you will finally see it going up a bit. So something to look forward to and fight for, hopefully.
And the last two things I'll mention, but are not part of the Shoemaker protocol, so I'm going to caveat this heavily, is one, there's a paper that shows early morning sunlight specifically, so like horizon sunlight can help stimulate alpha MSH in the body. So if you're someone who does red light therapy or you're someone who does like the watching the sunset, sunrise type of thing, that might help with MSH recovery. And then the other one is possibly KPV, which is a peptide. It's still in the very early stages of research, but it's been shown in research to stimulate alpha MSH. It's kind of an exogenous supplement to it. It can help with symptom management, but it's not going to be corrective of root cause. And I'm saying that because I don't want people to stick band-aids on, like if you were to say, well, okay, this sounds easier than doing the Shoemaker protocol, I'll just do the KPV. While it might be helping you recover your MSH in the short term, if you were to stop it and you're still in exposure, or you haven't eliminated the biotoxins, you're still going to have that root cause underlying problem. And the reason we're so against band-aids here and we're so against just doing the symptom management piece of treatment is because your brain is still atrophied.
Yeah.
We don't want people with tiny little brains. I always think of that scene from Beetlejuice when he's sitting in the
Yes.
waiting room and the witch doctor gives him like the tiny little head. Like that's that's how I see people who are just like, I'm just gonna do symptom management. Like I just see you as Beetlejuice with the tiny head. Know that. Know that I
Yeah.
see you as that person. But seriously, I really I just want to encourage everyone to do the protocol in order. It's been shown to work for CIRS patients. It's been shown to address the root cause problems so that you're not dependent on all these different supplements and adjunct therapies and different modalities just to manage your symptoms. Treat the root cause and you won't have symptoms to manage.
Yeah, nobody here wants to be on a supplement or even a especially medication for the rest of your life and just kind of get through life doing cold plunges and saunas and, grinning and bearing it and normalizing some of these symptoms. You want to get to the root cause because, again, not to fear monger, but like the tiny brain situation, like that leads to eventual neurodegeneration. And we know what that looks like. We all have somebody in our life or you know, certain politicians that we can see that happening with over time. And we don't want that for ourselves and we don't want that for our loved ones. So we want to maintain our brain matter to its fullest extent and capacity into our old age. So with that, if you would like more support and love and information and shared resources beyond what we talk about here on the podcast, join us over at the cirsgroup.com, which is our group for members. Otherwise, we will see you next week.
See you then.